a little bit behind schedule, so we'd like to try to get started. So if we could all sort of just settle in. My name's Elena Goldstein. My name's Elena Goldstein, and I'm the Director of Roads to Independence out of the College of Pharmacy at URI. I want to thank you all for coming today. We are very excited about being the first state in the country to have such an event like this, where we've got Social Security, state agencies, advocates, employers, all around the same table to discuss really changing attitudes and changing lives for people with disabilities, to make it clear that people with disabilities can and are able and want to go to work. I'm very pleased now to introduce Gary Alexander, the Acting Director of the Department of Human Services, who will be giving our opening remarks. Unfortunately, the governor had a conflict and wasn't able to be here, but Gary, could you give us some opening remarks?
Good morning, and welcome to the country's first federal and state Social Security Disability Summit, Changing Attitudes, Changing Lives. This is indeed a landmark event, and we thank all of the people who put this program together, and most notably Elena Goldstein, for all of your efforts. Due to your commitment to enhancing the lives of Rhode Islanders with disabilities, your feedback today will provide a valuable foundation to the summit dialogue. Our hope today is that this summit will provide a forum to develop public-private partnerships committed to providing a seamless administration of work incentive programs and supports for Rhode Islanders with disabilities who want to work. Again, welcome to this landmark event, and we thank you for coming. And to all of you who are from out of state, we welcome you to the Ocean State, Rhode Island. Thank you.
Thank you, Gary. Now I want to take the opportunity to, I guess you have all met Wendy Adams, but Wendy is going to be our facilitator for today, and she's currently the organizational effectiveness consultant for APHSA, which is one of our technical assistance center in Washington for the Roads to Independence project. Most recently, the founding and managing partner of a consulting firm, and she's spent the last 20-plus years serving professionals within all workforce environments, supporting federal, state, local government, nonprofit, union, and Fortune 100 organizations. Without further ado, Wendy, the show is yours.
Thank you. Oh, didn't tell me about the little bump in the floor. Got the wire here.
It's always a bump in the road when you have a disability and looking for work.
Absolutely. Good morning, everyone. We're going to actually begin with an introduction. Then we're going to kind of go into the agenda for the event and expectations and roles. Because although you see roundtable with active voices up here, we also are looking for active voices with our peer group as well. I'd like to begin by allowing our summit participants to introduce themselves by their name and the environment in which they're representing. And I think we'll start with Steve.
Good morning, everybody. My name is Stephen Florio. I'm with the Rhode Island Commission on the Deaf and Hard of Hearing, the Executive Director.
Good morning. I'm Fred Gordon, the District Manager with Social Security in Providence.
Good morning. I'm Lorna Ritchie from the Ocean State Center for Independent Living here in Warwick.
Good morning. I'm Vivian Spencer. I'm with Senator Sheldon Whitehouse's office. I'm brand new at this game, and I'm a constituent worker and also do special projects.
Hi. My name is Sharon Brinkworth, and I'm Executive Director of the Brain Injury Association of Rhode Island.
Good morning. My name is Chuck Messina. I'm a staff attorney with the Rhode Island Disability Law Center in Providence.
Good morning. Sandy Lupovitz. I'm an employer, Rhode Island Bureau of Investigation. We're a security officer and investigation company. I'm also the steering committee of the Rhode Island Business Leadership Network and and a member of the Governor's Commission on Disabilities.
Good morning. My name is Dawn Mordiga, and I am the Program Director for Family Voices at the Rhode Island Parent Information Network. And I'm here actually representing children and youth as they prepare for future, children and youth with disabilities as they prepare for employment possibilities in the future. I also do public policy work for the Rhode Island Parent Information Network.
Hi, good morning. I'm Steve Tamburo. I'm with Raytheon Company. I'm president of the Raytheon Persons with Disabilities Group in the Northeast. Also, actually for the whole country now. I'm also co-chair of the Rhode Island Business Leadership Network, and I'm chairperson for the Board of Directors of Goodwill Industries here in Rhode Island. Thank you.
Hello. I'm Jill Houghton. I'm the Executive Director at the Ticket to Work and Work Incentives Advisory Panel in Washington, D.C., housed in the Social Security Administration.
Gary Alexander, Acting Director of the Rhode Island Department of Human Services.
Buenos dias. Is everybody awake? My name is Berthy de la Rosa Ponte, and I am the chair of the Ticket to Work and Work Incentives Advisory Panel. Our offices are in Washington, D.C., and Jill is the executive director. But most importantly, I'm a parent of a young lady with significant developmental disabilities, and she's my teacher, and she's the reason why I'm here. And her name is Lucy. Thank you.
Good morning. I'm Francis Cross. I'm the Social Security's Area Work Incentive Coordinator for the state of Rhode Island.
Hi, I introduced myself, but I would like to take this opportunity to thank my staff. Those of you who have been sitting in the room for a while have sure met Valerie Shore and Kate McCarthy Barnett for really, without their help, we would never been able to put this together. So.
I'm Martha Rority, and I'm the Director of the Center for Workers with Disabilities and the Director of the National Association of State Medicaid Directors.
I'm John Young. I'm the State Medicaid Director.
Good morning, Steve Brunner. I'm with the Office of Rehabilitation Services. We administer the Public Vocational Rehabilitation Program.
My name is Pat Curtis, and I am the Director for the Work Incentive Programs in the state of Illinois, primarily with the Illinois Medicaid Program. The only other thing I want to add, it was 82 degrees when I left Chicago yesterday.
Good morning. I'm Bob Cooper with the Governor's Commission on Disabilities.
Good morning, ladies and gentlemen. My name is Don Latondra. I'm Dean of the College of Pharmacy at the University of Rhode Island. The Roads to Independence program is coordinated through our College of Pharmacy.
Good morning. My name is Kathy Partington. I'm with the Department of Labor and Training, and I'm pleased to represent our director, Adelita Orafici. One of my main responsibilities over the years has been involved with Rhode Island's one-stop system called Network Rhode Island. I've worked with many of the great partners around this table in the hopes to make that system accessible to people with disabilities. I think we've done some great work and a long way to go. Thank you.
Good morning. My name is Steve Kitchen. I'm Vice President for Corporate Education and Training at New England Institute of Technology. I am Chairman of the Roads to Independence Steering Committee and also Chairman of the Workforce Partnership of Greater Rhode Island, which is one of 3 workforce investment boards under the Workforce Investment Act here in Rhode Island.
Good morning. My name is David Cienko. I'm with the Rhode Island Department of Elementary and Secondary Education, Office of Special Populations. I am also the chair of the State Rehabilitation Council.
Good morning. My name is John Holder. I'm the district manager of the Social Security office in Warwick.
Good morning. I'm Mark Rowinski, professor at the University of Rhode Island Physical Therapy Program, and I represent the Rhode Island chapter of the American Physical Therapy Association as its president.
I'm Vivian Weissman. I'm the director of the Rhode Island Parent Information Network, and many of our programs are actively involved in developing systems change for transitions for youth into the adult world.
Good morning. I'm Jackie DaCosta, constituent caseworker for Congressman Patrick Kennedy.
Good morning. I'm John McCrulis. I'm the deputy administrator, Rhode Island Disability Determination Services, which employs the Social Security Disability Program.
Good morning. I'm Leo Canuel, the Executive Director of Perry Independent Living Center.
Thank you all. Please give a round of applause for the folks who have joined us today for this seminar. It's interesting that we have a panel today that are coming together with very diverse perspectives. You may hear from all of them. You may hear from some of them. Some folks may be just kind of listening and absorbing and putting into some perspective some future compliment that they can give at a later date with regard to our important program today. With regard to roles, we have our active participants in the summit that you see around the table. I also include our audience, our peer group, as active participants, in that you have an avenue in which to document and to relay information back to this group. And we certainly welcome that. So as you're hearing comments and you're hearing responses and you're hearing the information that's being presented today, please feel free to take notes around what you're hearing and to provide to us feedback as a result of this important day's work. We have a very ambitious program. I don't need to tell all of you. You could take a look at your watches and take a look at the time frame. We have asked the participants to honor the time frame by being as clear and concise with their responses as possible, by honoring each other's information and providing clarity to that information when necessary. We have also prompted today's meeting by putting in advance questions, pre-event questions, and I'm sure that you have copies of those. In fact, someone this morning said that they were very helpful for kind of putting in their minds what their expectations were with regard to the dialogue. And I really have to defer and open this up to the summit participants because they certainly know the issues that are primary in the minds of our clients, primary in the minds of legislators, and people who are charged with deploying the services in the field. I'd like to begin with Dean Latondra because I know that he has a very sequestered time with us today. But I'd like to start our dialogue there with your permission, sir, as based upon what issues you see are most prevalent in the minds of people within this service delivery system.
Oftentimes, can you hear me in the back? Is it clear? Oftentimes, individuals ask, why would the College of Pharmacy be involved in a program like Roads to Independence? And it's important to understand that as a College of Pharmacy, our responsibilities extend well beyond the medication process, medication use process, and access to medications, but also includes responsibility of pharmacists in the broader dimensions of healthcare. It's key as a part of that responsibility then to work closely with providers, with insurers, with employers, with state legislators in trying to ensure that medications and other critical healthcare needs are obtainable at an affordable price and on a consistent basis by all citizens, including those with disabilities. We know from our own research, from our own work as healthcare professionals, that individuals who take medications on a chronic care disease state basis do so, but almost 50% of the patients that are cared for after 6 months of therapy do not take their medications appropriately. And you know the attending consequences associated with that. One of the principal reasons for people not taking their medications appropriately after 6 months is because of affordability.